Okay, we're going to get started, everybody, so we can finish on time.
No, you're fine. You're fine.
Okay, so I'm going to introduce myself and Andrea. Some of you might have remembered us from this morning. We were the Energizers. I know it's later in the day, but we're still energized. If we find there's a lull, we're going to make people stand up and do an activity. So I want to engage.
We might do a little dancing.
A little dancing. Yeah, you dancing? Yeah.
Like now?
Dancing now? Oh, no, I just wasn't being. Okay, so my name, for some of you that don't remember from this morning, is Melanie Davis, and I work for the North Bay Prairie Sound District Health Unit as the Healthy Communities Coordinator. So that's how I got linked up with HC Link, no pun intended. And I've been asked to introduce Andrea. Andrea and I have worked on quite a few projects now. And yeah, we always seem to find a little bit of trouble and have a good time, but always get the project done. So that's what's important. Andrea's worked on a lot of projects, and she's been with HC Link since 2009. Andrea's worked on physical activity and health promotion for more than 10 years in local recreation centers, public health units, as well as provincial NGOs and agencies. She is very passionate about healthy communities. She's also very passionate about knitting.
Yes.
And yoga.
Yes.
And lots of other things. So if you get a chance to talk to her, you can ask her about those things. We have a great size. We were just saying it's a great group size to work with. So please, we want it to be interactive. Stand up, sit down, do whatever you need to do. We're going to talk about the evaluation at the end. It'll be the same with the stickers as your last session. And we're all for tweeting, especially Andrea and I. We're the ones that want tweets all the time, so feel free to pull out your phones. We're not going to think you're doing other work, because you're not. You're just tweeting. And yeah, I think that's it. So I'm going to give it over to Andrea.
Okay,
Good.
well, okay, so hi.
Hi.
Hi. Okay, so first I just want to say hi, Mom, because I think my mom's watching me over live stream. And I do want to say hi to everybody who is on live stream, and you can ask questions via Twitter, or you can type them to Robin and she will see them and ask them on your behalf. So before I get any further, I want to just make sure everybody knows that this is an introductory level policy workshop. So the concepts are introductory, they're beginners, and I don't want any of you to leave. But if you've been working in policy for a little while and you're thinking, maybe I'll check out another session, I will not be offended if you get up right now and look for something else to do. Absolutely not. So I wanted to talk a little bit at first about why I developed this workshop. And it's the idea for this workshop came when I was doing some work with a health unit up in Northern Ontario. And what we were doing is we were traveling around to 4 different municipalities out in rural areas in Northern Ontario. And we were talking with the municipalities, so the actual municipal staff, about policy. And I remember clearly in one meeting, we had the clerk of the municipality sitting forward in her chair, talking, and as soon as we said the P word, she leaned back in her chair, crossed her arms, and her face closed. And probably a lot of you have had a similar experience. As soon as you say the policy word, it means so many different things to different people, and a lot of people have a lot of associations with the word policy that maybe aren't all that cheerful. So I thought I would put this workshop together to try to demystify policy a little bit and to try to get people to not be quite so scared of the policy word by explaining what policy is, how you can do it, and how you can get your community partners and your members on side. So that's why we're here today. I want to mention that my PowerPoint, it is going to be available on the HC Link website, but it's practically all pictures. It's not going to be particularly helpful for you. It's meant to be entertaining up here. But you have a handout on your tables that has kind of the guts of what I'm going to talk about, including a great little roadmap and including some resources and including some information about how HC Link can help you. So please feel free to refer to that throughout the session today if you would like to. Okay, so we're here today because policy has an integral role in the work that we're doing to build healthy communities. Many of the health conditions that the populations that we work with can be linked directly to policy decisions. And one of my favorite things about this quote is that this is actually someone from the Ministry of Health and Long-Term Care, who will remain nameless, that said this. Poor living is a result of poor environments, which are a result of poor policies. So this is not entirely a new thought. I think everyone in this room is probably familiar with the Ottawa Charter for Health Promotion, and you can see at the bottom, the cornerstone of the Ottawa Charter is building healthy public policy. It's also really important to know that a lot of the decisions that affect the health of the people in our communities lie outside of the health sector. We heard this morning from Kate Manson-Smith that there's a great interministerial table I'm so excited about that has all of these different sectors. There's all of those different sectors, all of those groups of folks involved that can affect the health of our communities. So your role really is that every member of the community can work in policy. A lot of times we think that policy lies solely in the governmental realm, in the municipal realm, but really we can all get involved with policy. Whether we're managers, whether we're decision makers, whether we're advocates, whether we're lay workers, whether we're community members, we can all get involved. But a lot of us are confused about what policy is, why we should do it, what's involved in it, and again, that's why we're here today. So today, we're going to talk about what the heck policy is, exploring some of the broad concepts. We're going to talk about why you'd want to do it in the first place, and we're going to hopefully get everyone nicely calmed down, though you're all looking pretty calm in this room. But a lot of times I'll walk in to deliver a 3-hour workshop, and again, people are looking like they're at the end of a shotgun. So I'm going to start off with a nice simple definition of policy, and this is from the Park Workbook for Influencing Physical Activity Policy, and it's referenced in your handout so that you can find it easily. And the definition is, policy is the position or guidelines of organizations and governments which define and support particular values and behaviors. I also have an alternate definition. Policy is like sausage. Nobody knows what's in it, and no one wants to see how it's made. So policy, like I've mentioned before, can mean many things to many different people. To those in government, the P word summons up years of work, lobbying, rewrites, going to parliament, going to council. In workplaces, policies can guide behaviors. They can set out expectations of how the work gets done and how we should all behave in the workplace. In communities and homes, policies could be informal. They could be formal, like curfew times, like this is how we sit down to dinner. But because of this, one of the biggest barriers in policy work is the P word itself. Again, we all carry those different definitions with us. And I mentioned the story of the municipal clerk just a few minutes ago in Northern Ontario. And one of the things that I think is important about that story is that when we start talking, rather than we're going to do policy, and we start talking about what are some of the great things you're already doing in your municipality that aren't written down yet, and can we just get some of those things written down, the barriers come down and people just open up. So given that, there's lots of different things that you can call policy, lots of different words that you can use. And at this point, I just want to acknowledge that a lot of the material for today's workshop actually came from a Twitter chat that I hosted a couple of weeks ago on policy, and we had some great folks tweeting their ideas. And one of the questions that I asked people in the Twitter chat is, what are some of the other things that you can call policy that maybe people in your community are going to respond to a little bit better? So some of their suggestions were, this was an interesting one, it's a pathway to get us to where we want to go. They're guidelines that help us function better at home, in communities, and in government. They're procedures. Oh no, is that another spelling mistake? They're principles that can guide us in our work, and they might also be standards that we want to uphold. And one of the things I really encourage when you're doing especially community-based policy work is really take a few minutes to actually explore policy together. Maybe put a definition together, or at least put some keywords together, so that everyone is on the same page in terms of what policy is and what you want it to do. Okay, I'm going to get a little bit technical here. So there's a few different types of policies. And you're probably familiar with these terms, macro, meso, and micro, maybe not in the policy framework, but kind of as a general sense. So when we talk about macro level policies, we're talking about government policies. So we could be talking about the children's fitness tax credit. We could be talking about the daily physical activity legislation in the province of Ontario. We could be talking about something at the municipal level, like the smoke-free policies before Smoke-Free Ontario came in. Then we have meso, or sort of medium level policies. Policies within organizations like workplaces, like where we all work, healthcare settings, schools, grocery stores, restaurants, etc. And what those types of policies do is they guide the day-to-day operational practices of staffs and volunteers and clients. And then, of course, we have the micro level. So policies that affect neighborhoods, policies that affect homes. And each of those have different functions. Each of those have different ways to go about doing it. So I'm going to put you guys to work for just a second and ask you the question, what are some of the policies that impacted you from the time that you got up this morning to the time that you walked into this room? And I'm just going to ask you to popcorn them out. And Mel, could you maybe write them down?
Yeah, for sure.
Thanks, that'd be great. Yeah, Bronwyn.
Heating policies, like I live in an apartment, so our landlord has to keep the apartment at a certain temperature, and this time of year can be difficult for people.
Okay.
Cold.
That's a great example. Yeah.
Mine is the organizational, having to be at the airport for 5:30 for my flight.
And how is that an organizational? Do you mean the airport authority policy?
Yeah.
Okay. Great example. Anyone else? Yeah. Hi.
Catering policies or anything related to event planning.
I can't relate to those at all. Any other ideas? Yeah, Jennifer.
About paying to get on the TTC.
Paying to, oh, that's a great example of a policy, and those Torontonians in the room, we probably don't want to talk too much about the TTC. Hi. Yeah.
Well, building on that, a policy in my household for the adults to share a Metro Pass, so that we decide who takes it that morning.
Oh, that's a great example. Any other informal policies, maybe ones that aren't written down, that you all follow as rules? In the house or in the workplace? For example, in my office, we don't have a formal dress code policy, but everybody wears jeans on Fridays. So it's an informal policy. Jillian, did you have your hand up?
Who should take the dog out?
Yep. Yeah.
No cell phones at the dinner table.
Oh, that's a great one. One of my favorite home policies is whoever cooks does not have to clean up.
That's my rule too.
Yeah. Good one. What else?
Except I clean all the time because I don't cook. That works.
Any other ideas? Okay. So lots of you actually rhymed out what types of policies these are as you spelled them out. So we've got a pretty good mix of some micro policies, of some more macro, as well as some of the meso policies. So I thought I'd just give you a few other examples too, just to kind of illustrate some of the different types. And I've mentioned some of these already. So if you look at the government level, I've talked about the children's fitness tax credit, the daily physical activity legislation. There's lots of policies that guide restaurant safety, and Ontario Works is another great policy example. There's lots of policies included within that jurisdiction. We also have at the organizational level attendance policies, a dress code policy, and some of these are formal and some of these are sort of understood or not really written down. And lots of workplaces have great wellness policies as well that can help to promote a healthy workplace environment. And finally, at the micro level, so at the home or the neighborhood level, lots of folks have policies around screen time, and you mentioned no cell phones at the dinner table, which is a great policy. I mentioned that lots of homes have policies around curfews. There might be some policies at the neighborhood level around safety, around parks. There's lots of policies around off-leash dog parks and picking up after your pet and all of those kinds of things. So hopefully you can see that policy can really happen at a whole bunch of different levels. And depending on what level it's at and who you want to involve might dictate how you want to approach policy. So I'm just going to go into a little bit on how policy can actually work. And there's lots of different approaches to doing policy work. And some of them are really organic. And you probably already heard my definition for the word organic this morning, which is something like we make it up as we go along, or things tend to evolve as you move forward. And some policy work is organic and some is a little bit more structured. So I've got a few different examples about how policy can go. So my first one is top-down. So top-down is a great example at the government level, whether that's federal, provincial, or municipal, where a group of people come together and decide on a policy that's going to affect other people. So the example that I have for this one is daily physical activity, which came in Ontario, someone help me, about 10 years ago or so now. A little bit of a mix of reactions to that policy. I think those of us who worked in healthy communities and health promotion were pretty excited about it. One of the hiccups with the policy is that school boards were really left to implement the policy in schools at the micro level, and there wasn't always a lot of consensus about how to actually interpret that guideline. There were different levels of support depending on the board, depending on the school. And so today, almost 10 years later, there's still a little bit up in the air in terms of how is DPA actually being implemented, and is it actually being implemented 20 minutes a day. So the next example is bottom up. And the story that I love to tell about this one is the booster seat legislation, which came in Ontario about 6 years ago or so. And this is an interesting one because this is a provincial legislation, and there were 4 people at the local level in Halton and Norfolk counties who worked and got this from ground zero to implemented in the provincial legislature in 5 years. 4 people. And I'm going to talk a little bit more about how they actually did that in a little while. But that's an example of the injury prevention health promoter at the local public health unit saw the stats coming in from the injury prevention reports and saw all of these kids who were being harmed, who were being killed because they did not have to be in booster seats in vehicles after the age of 4. And so 4 people, a police officer, a couple people from the health unit, and someone from a local community organization got together and basically nagged politicians to death until the politicians relented and said, oh, for goodness sakes, leave me alone and I'll put your policy into the legislature, and that's exactly what happened. So we also have examples of top-down and bottom-up. And the one I like to talk about here is Smoke-Free Ontario, because lots of you who are from the Ontario Heart Health program and lots of other great folks who are working on the ground in local municipalities to get smoke-free policies implemented. I'm sure you all remember the hullabaloo when the no smoking in bars and restaurants came in. A lot of us, that's really fresh in our minds. And one of the things I think this policy really illustrates is the first research showing that tobacco was harmful to human health came out in the 1950s. Smoke-Free Ontario came out in 2007, 2008, 2006, in the mid-2000s. It can sometimes take a really long time. And the bottom-up, top-down can be really helpful because often politicians are looking to see how many people are buying into this. We don't want to just implement something and have it blow up in our faces. I'm not going to say anything. This is a really interesting one, and the first time I delivered this workshop, I worked on it with Jen Wilson from PARC, the Physical Activity Resource Center. And this is actually an illustration of Jen's, and hopefully I can talk a little bit about the policy. We call this one the scoop, which is, as you can just imagine, the policy comes from the government, but then the community gets really involved, picks it up, and actually boosts intake. And the example that we have for this is the Accessibility for Ontarians with Disabilities Act, which probably many of you are familiar with because many of your workplaces are making some changes in order to follow this policy. So what happened with this one is that the government implemented the policy, and then all of the grassroots community groups who were working in this area for so long said, hallelujah, we've got a policy that can actually back it up. And they started picking it up at the local level. They started creating resources. They started boosting awareness in their communities and actually helping people to develop the policies that go in line with this big provincial policy. So that's an example of how something can come from the top, but the community level can really animate it. Because of course, just implementing a policy, just writing it down, just passing it in the legislature isn't enough. You need to get people to take it and actually make it happen at the local or whichever level it happens to. So, I love this picture. Do policy, they said. It'll be easy, they said. And then all of a sudden we're hanging off the edge of a cliff. Often policy work can kind of feel like that. You know, we're in a meeting and we think, oh, we should do a policy on this. And we think it's a great idea. And 6 months down the road, we think, what in the world was I possibly thinking when we decided to do this? So I thought I would just kind of go over some of the reasons to actually do policy, why it's so important, particularly when we're talking about healthy communities. So I thought I'd go back to the quote at the beginning from the unnamed ministry person. Poor living is a result of poor environments, which are a result of poor policies. Now, lots of us who have been working in health promotion and public health and healthy communities for years and years and years know that a lot of times what we're trying to do, or what we have done historically, is we've tried to address poor living. You're not eating well. We're going to tell people to eat 5 to 10 servings of vegetables a day. Then we started thinking, oh, we can't tell people to eat 5 to 10 servings of vegetables a day if they can't actually buy those in their community. Then we realized we can't tell people to do that if they're on Ontario Works and they actually lack the income to go and buy the vegetables that they don't even have in their neighborhood. And what I think is really important about this is that policy work, good policy work, addresses the determinants. So the roots, the causes of what it is we're trying to change in our communities. And without addressing that at the policy level, oftentimes that change is just not going to happen. Some other benefits to doing policy is that it ensures consistency, and it can ensure consistency across different entities. Like if you're in a multi-tiered municipality, or if you're in a province like Ontario that has many different jurisdictions, having a policy in place means that all of the jurisdictions within that are going to have to follow that policy. It can also ensure consistency through changes in leadership and government. And we know, particularly where we are right now, actually in all 3 levels of government, there's a little bit of an up in the airness about what's going to happen with our municipal, with our provincial, possibly even with our federal leaders. So getting things written down, getting things passed, whether it's at council or whether it's in a legislature, means that whatever happens with that change of government, the policy is going to stay. And that's critically, critically important. And just to go back to that example of the Northern Ontario community where we were going out one-on-one with municipalities, I was in one fabulous municipality. Unfortunately, I can't use names because I would have had to go through the health unit hierarchy to get approval. So I'm just saying, municipality in Northern Ontario. A little tiny wee, gorgeous, gorgeous place. 500 people live in this town. They have a gorgeous recreation center. They have an amazing hockey rink. And they've got great policies in place that ensure everyone in the community has access to recreation, regardless of their income. But those policies aren't written down. So if there is a change in government, if there's a change even in staffing of who is running the recreation center, there's a chance that some of those things could change. So when we went in and talked with that municipality about how can we do policy to increase access to recreation, we didn't make any recommendations to do anything different. They were already doing amazing stuff. They just didn't have anything written down. So for them, it was a matter of getting everything written down, having that passed by council, so that those policies can survive whatever happens. I just actually am going to pause for a second because I realized that I completely forgot to say, please do feel free to ask questions at any time. So this actually might be a good place to stop and take a breath and see if someone has a question right away. Hi. If you wouldn't mind also saying your name and where you're from, if you're comfortable doing so.
I'm Kendra from the Halton Region Health Department. And in one of our municipalities, we have a cycling master plan, and it came into effect just prior to the previous election. And there's some people now on council who don't believe, support, weren't part of that process. And now every time something goes forward to implement the policy, there's challenging happening all the time. So I just want, I guess it's not a question, but just to point out, it doesn't guarantee everything, but it is a good starting point to have a plan to be able to begin to.
Yeah, that's a really great point. And I'm a Torontonian and I'm a full-time cyclist. And we certainly face those battles here in the city all the time, where I'm sure lots of people heard the story of there was a bicycle lane put in on a road that cost $75,000 to put in, and then the municipal government spent $275,000 to take the bike lane out, and that actually came out of the cycling budget. So, you know, it happens all over the place. And what I'm going to say, and then I would love to hear from everyone else in the room, because there's so much expertise sitting around these tables, is that there is a difference between implementing a policy or passing a policy and actually implementing and getting the uptake. And on your handouts, one of the resources that I talked about is the HC Link website. On our resource section, we have a section on policy, and one of the great resources on there is called Policy Uptake. And it's written by Kim Bergeron, who's now working for Public Health Ontario, and she's actually going to be here tomorrow presenting a session, which is super exciting to see her again. And in that resource, there's some great ideas on how to really ensure uptake, because that's really what we're talking about. We have it written down, but it's not actually being implemented, and what are some of the things that we can do. So before I move on to anything else, does anyone have any suggestions or any comments on that?
So I have a separate question. Just thinking about the Healthy Communities Fund and how that policy is defined. I'm not always clear when they move forward. I'm just part of one of the people helping to implement it. Like, we're doing policy around active transportation, and it's sort of open. I don't know what policy means in that scenario. Exactly. Has that clarity.
I'm looking at Jennifer Chatter. No.
Your presentation.
Oh, darn. So is your question, how do we define policy in that particular program stream?
Yeah.
I think that's a great question, and since we don't have anyone from the ministry here to answer
No
I'm
problem.
going to say, how does your community want to define it?
That's what I'm thinking. That's what I wrote down what you said.
Yeah,
Explore
and-
the idea of community.
Yeah, and how do the people that are working on that want to define that? And you've got your hand up.
And I think you illustrated it well. It can happen at those three different levels, from a micro all the way up to a meso, depending on what's needed in the community and identified.
Any other thoughts on that or anything?
I
else,
can
Jennifer?
say something.
Okay, thanks, Jennifer.
So you said implementing, and so for us that's always sort of a flag, because for healthy communities, we really do, we fund policy development up to the implementation phase. We don't fund the implementation. It's your big idea. It's your beginning of pushing that policy, and then once you get to a point where you're going to take that policy and run with it, that's up to the health unit, the municipalities, and that sort of partnership there to carry forward. I don't know if that helps, but.
Yeah, I think that's a great point, Jennifer, and that's about a specific program, and I think what it really illustrates, as I said and as you said, that the work doesn't stop when the policy is passed, when the policy is created. And in many, many, many cases, especially when you're looking at the top down, that's when it starts. Exactly right.
So I'm doing some work around policy within my own community. To give you a little bit of context, I say I, but I mean it's a bunch of partners. We came together, so I put together an advisory group on putting together HIV policy. We're starting at the micro level, hoping to get to the macro level.
Mm-hmm.
And what the workshop is going to look like is why you need an HIV policy, some of the issues that come with having HIV, the stigma, discrimination, blah, blah, blah. And I'm having a lawyer come and speak to some of the liabilities of not having an HIV policy and do like a risk and benefit analysis. But my question is, what would you recommend the approach be? Because I'm chairing the advisory group, but I'm letting the community take the lead on this because I want a buy-in. And if it's coming from an ASO, they're gonna be like, well, hold on a second. But if it's coming from the community groups, then there's gonna be a better buy-in about what types of, I don't know, how would you engage the rest of the group?
What a great question. And do you mind if we come back to that a little later
Sure.
on? And can you spell out ASO for us?
AIDS Service Organization,
Thank
sorry.
you. Yeah, no problem. Okay. All right, so I'm going to move on, but again, please do feel free to ask questions. But one of the reasons I want to move on is that a lot of the things that you're asking, I'm going to talk about.
Because I just don't know what you mean by uptake, right? So
Yeah.
I'm just trying to figure out what that's going to look like in terms of this workshop. Because the workshop is designed to get them engaged in that whole process, help them think about, how they can, I'm going to present a few policies and say, okay, now how can you fit this within your organization?
Yeah.
But it's the aftermath that I need to really focus on. Right?
And
So,
I'm totally going to talk about that.
okay.
And if I don't, please remind me. Okay, so one of the things that I think is really important about policy is that all policy is not created equal. I hate to use these labels, but I think it's probably fair to say about policy and about lots of other things. There's such a thing as good policy, and there's such a thing as not so good policy. And I think we could probably all come up with lots of examples of each one right in this room. But I wanted to put up this quote from the World Health Organization that really talks about what good, healthy public policy is. One of the first things is that it's informed by evidence, and it brings about an important change through a variety of tools. And we'll talk a little bit about the tools a little later on. And as we know from the Ottawa Charter, good, healthy public policy makes healthy choices easier. If the right policy is chosen and if it's implemented well, it can lead to healthier individuals and communities by addressing chronic disease risk factors and social determinants of health that can negatively impact health. For example, I talked a little bit about the access to healthy food, which is really great, topical, good, juicy policy. Is that oftentimes the barriers that people face in eating healthy food are actually constructed through policy. Conversely, or actually that might be also a good example, is that bad policy makes it more difficult for people to make healthy choices, and it can often establish or reinforce structures that can disadvantage groups of people, sometimes not purposefully. And that brings me to a little note about health equity. And I've got a couple pictures here. This one I love. This one is from Denmark. And what we have here is 3 little pictures of a little person who is trying to work towards achieving good health. And the first person has all the advantages in life and is able to get to the finish line and achieve good health and absolutely no problem. The second person has a few little bumps along the way. The third person has 1,000 pounds on his back and has quite a few hurdles to jump. And a lot of the things that affect health, as I've mentioned before, are actually due to some of these systemic or systematic barriers that keep people from achieving. The next picture I have is a new find of mine, which I absolutely love. Because a lot of people think that health equity is about giving everybody the same thing. But really what health equity is about giving people what they need to achieve as close to the same outcome as they can. So in this picture, we've got 3 little kids watching a baseball game. And in the first picture, everyone has a little step stool that is the same height. But the problem is that these 3 kids have different heights. So giving them the same thing does not give them the same outcome. Whereas in the second picture, we have folks who have been given different amounts of barrier to help them achieve the same height so that they can all 3 see the same game. So one of the things that I want us to talk about is that we often really love to do policy because it's, I love this term, it's a blunt instrument. It is seen to affect everybody in exactly the same way. But I think as the two pictures that I've just shown illustrate, is that a lot of those, even well-intended policies, can have unintended consequences. They can create health inequities, they can exacerbate health inequities. So we do have to be careful when we're considering policy options to make sure that they don't either intentionally or unintentionally cause or create inequities, especially by widening the gap between vulnerable or marginalized populations and the rest of the community. Policies can be a powerful tool to make sure that individuals and populations have what they need to be on a level playing field. So I just couldn't do a policy workshop without talking about inequities. Okay, this is my favorite piece of advice. I grew up in the 70s and 80s, and I was a pretty big fan of The Hitchhiker's Guide to the Galaxy, which some of you may know, which was famous for having the words "Don't Panic" in large friendly letters on the front cover. And this is something that I often say to myself actually in daily life, but I think is particularly important when we're talking about policy. Policy does not have to be a big deal. It doesn't have to be federal, it doesn't have to be municipal, it doesn't have to be 17 pages long. It can be, but it doesn't have to be. Policy can be, as I've mentioned, as simple as writing down a current practice to ensure that the policy is sustained throughout changes. Policy can be as simple as just getting a bunch of people together in the same room and starting a conversation. On the other hand, policy can be pretty big undertaking. I love this sign because, like, really, where am I supposed to go? And oftentimes policy can feel like that because sometimes people put up barrier after barrier after barrier, and you think, okay, well, if I can't go straight, I'll turn left. And then all of a sudden, you can't do that either. So the good news is that there is a really great process that I highly, highly recommend. And it's a roadmap, and it is from the former Health Communication Unit, which is now a part of Public Health Ontario. And this is one of those oldies but goodies. I mean, you just have to keep going back to it over and over and over again. And this is a 8-step process to kind of guide you from A to B in your policy development efforts. Now, I'm not actually going to go through step by step today. That's a completely different workshop. And there are workshops available on that, and there's tons of great resources on this workshop, on this roadmap, and they're listed in your handout as well. But I wanted to just mention that a lot of times we think that policy work is very linear. We do step 1, and then we do step 2, and we do step 3. But really, if I wanted to accurately draw the policy development process, it would probably kind of squiggle all over the place, and you're on step 6 and you need to go back to step 2, and then all of a sudden you can pop out to step 4 and back and forth. And so one of the things that's really important, and I'm going to talk about this a little bit more later on, is that when you're doing policy work, there's an awful lot of patience that is required, because it can take a long time to do policy. And one of the things that I think is really beneficial about following, oh my gosh, another spelling mistake. I probably shouldn't be pointing them out. One of the things that I think is really beneficial is when you're starting your policy development efforts to think about what are some of those great milestones along the way, so that you can show that you're actually making progress. You can show that to yourself, but you can also show that to your community partners. Because often when you're working as a group of folks at the community level, it can be pretty frustrating when you have roadblock after roadblock and you feel like you're not getting anywhere. So I'd highly recommend this resource. So I thought I'd kind of wrap up a bit today by talking about some common barriers. And of course, my whole theme for this workshop is kind of the 3 little pigs and the big bad wolf. And I was very pleased to see that all of these images are actually in Creative Commons, so Walt Disney has made all of these wonderful illustrations available for my workshop today. So what I thought I'd talk about are some of the common barriers. And again, I'm looking to the great folks who were on the Twitter chat a couple of weeks ago for giving me some of the common barriers that people face. And then between Mel and I, because of course I recruited my Energizer twin over here, we're going to talk about some community examples that show how some folks have gotten over those barriers, and we're going to be addressing some of the things that you talked about too. So, the first one we're going to talk about is understanding the issues and articulating the desired change. So, that language is a little bit crazy sounding, but this is critically important. Oftentimes, when we're going out into the world and trying to recruit people in our policy work, whether they're decision makers or a community partner that we want to have on side, we really need to make sure that we can clearly articulate in very simple language that those people are going to understand about what the nature of the problem is, why this policy is so important, and how it's going to help them solve that problem. And because you're going to be talking to different folks, you're going to be talking to people who are going to be proponents, who are going to be on your side and say, yes, I want that policy. And you're going to be talking to people who are opponents, people who do not want this policy. And you need to be able to talk in language that resonates to each of those different groups of people and help them to see your side of the story. And Mel has a really great example about language that she's going to talk about.
So my example of language was when I started as a healthy community coordinator. I had worked for public health for about 7 years at that point, and I was very good at speaking public health because I had been in it for a bit. And those in public health know that we have a whole language on our own. So when I started doing policy development for healthy communities, we really wanted to get the municipalities engaged. Now, we have 31 municipalities under the North Bay Prairie Sound District Health Unit, so we have a lot of people to go meet with. And when we first started, I was speaking public health, and they were speaking municipality planning. And those two languages were not the same thing. So when I would meet with the planning manager about their official plans, I'm talking public health and thinking I'm articulating it well, telling them what the problem is, explaining what we need to do, and they're talking to me about, to say, the provincial policy statement, what the official plan has to have, and I'm like, I don't know what she's telling me, and she's thinking the same thing, but we don't have a relationship enough yet to say, I don't know what you're trying to tell me. So eventually we get to that point, I'm like, I don't know what you're trying to tell me. And they're like, we don't know what you're trying to tell me. So it took a long time to learn a common, simple language around policy, especially at a municipal level. We also had the desired change. They wanted one thing as a municipality, and public health wanted a totally different one. I wanted physical activity levels to go up. I wanted better active transportation supports. And they wanted the transportation costs to go down, and they wanted some other things. So we both wanted different things, and we weren't talking the same language. So it did take a long time when Andrew talks about patience. Especially with a lot of our municipalities now, great relationships. And we'll be in meetings, and I'll be like, yeah, you lost me. Go back. You know, it's easy to say that now, but when the time came when it first started, we were just like, we are never going to get to talking about making policy change because we're not even talking the same language. So it's hard, it's challenging because you have to learn a whole new language a lot of the time. And what I found with policy, especially at municipal level, they felt the official plans are ours, that's our business. Public health, that's not your business. They didn't see the link between health and policy yet. So I had to learn a lot of the new language where the onus was on us to learn the new language as opposed to them, I found. We've definitely met further in the middle now, but yeah, so that's my story of trying to understand, to get to the desired outcome, and talk to communicate. Good job.
You're also talking two different levels of government.
Yes.
You're talking municipal level as in municipal
Yep.
setting, and in the public health setting, you're talking provincial because a lot of your strategies
Yep.
and the work plans that you folks work on are driven provincially.
Yep.
So there's also that disconnect
Yep.
that what's happening in a municipal regional setting may not necessarily be the same target goals as a provincial setting.
That's a great example to bring up. A good example of that is some of our key points to go to the municipalities with to get their buy-in was if people are more physically active, they're going to need the healthcare system less. They're going to drain those healthcare dollars less. Municipalities are like, good for you. We don't get those dollars that you're saving at the hospital level don't come back to us anyways. So great, you don't use a merge, but we don't care. Like we care, but we don't care. We're not getting that money. So we were like, oh, that's not a selling feature. And it took there was a couple examples like that. We're like, oh yeah, you don't get, if we save here, they don't get it. So sometimes you have to remember that. So that's a great example. And again, with the challenge of those government levels was public health gets our provincial funding, then we got the municipal funding, and then you have the municipalities, and then so we're trying to dance between both, right? That we're mostly provincial, but we have the money from the municipalities. So we have to be accountable to the province, Ministry of Health, and then we're accountable to the municipalities. So again, we're kind of doing the dance in the middle too. So yeah, it's a perfect example. To make sure you know what you're going in with as the selling points and communicate those and make sure they make sense to the people you're talking to. It sounds so easy to say, well obviously make sure, but let me tell you, I went into more than one meeting saying, these are the reasons people are going to be healthier and we're going to save money over here, and use that as a selling feature, you know, so to really know what you're selling and be able to make sure that they're going to care about that.
Thanks, Mel. And that's a really beautiful segue into my next, I think that's my next one. Yes, it is my next one. Is really understanding where your community, am I in the right spot, Robin? And where your decision makers are at. One of the things that's so important, and Mel was talking about one of the planners in North Bay, Bev Hillier, that she works very closely with, and HC Link and the North Bay Health Unit, North Bay and Perry Sound District Health Unit, worked together on an event last November, about a year ago, in North Bay, and Bev was a speaker at that event. And we have lots of other folks who work at the municipal level, who work in public health, who work in different sectors. And the one thing that we heard over and over and over and over and over and over and over that day was, go and talk to people. And preferably, talk to people and start building that relationship before you actually need them. And that's a little bit challenging, because sometimes you don't know who you need to talk to until you have the initiatives that you want to work on, and then it's almost too late to kind of create those relationships. But this is another thing where the patience really comes in, is because building those relationships and those partnerships can take a really long time. And just being able to understand what people's motivations are is critical to the work that you're going to be doing. And one of the other things that's really key is to really kind of judge how much support is there for this decision. And so this is partly where your question comes in, is that you're using kind of a community consultation or a workshop model to really judge how much support is there for the project. And you really need to have a sense of who in my community supports this and who doesn't, and why don't they, and what can I do, and also at that decision maker level.
And I have to admit, bringing this group of people together to create an advisory group, they only did it because they like me. You know, it's really hard to engage people in policy development. And the only reason why I managed to get this group together was because they like my work ethic, because I built relationships with them. So, you know, it was really challenging to get this group together.
It comes down to two things, relationships and food. And that's really what brings people together. And good for you for having those strong relationships. So the story that so two things I'm going to mention. One is that we have another really great HC Link resource. Of course, that's slightly biased of me to say. But it's also in the resources section on the HC Link website, and it's called Assessing Community Readiness for Policy Change. And it's written by Nancy Dubois, who is also here at the conference this week. And it's a great comprehensive resource that really talks about I believe it's step 2 in that policy roadmap, is how to really go in there and figure out where people are at in terms of your policy. And there's lots of different things that you can do. You can do surveys, you can do workshop models, you can do some media analysis. I know in the Niagara region, one of the things that they did is they hired someone to go through council minutes and figure out which councillors were supportive of which types of policies. And then they went and they talked to those councillors and got them to start to champion the work forward. So there are lots of different things that you can do. Another thing I want to talk about that also might be helpful for your go ahead.
Okay, so you've had policies, the community has bought in, everything's going well, and then public health changes the policies.
Can't be. Well, it isn't so.
Really? And then, a few years later, public health has new policies and wants the same community people to buy in. Now, I think I'm going to make people like me, because that sounded like a good way, you know, to get people on board. But any other thoughts?
I have a good example for that. You might even be talking about this is, so Healthy Communities started out with the 6 main topic areas, right? We did physical activity, healthy eating, substance misuse, all tobacco, all those ones. And we did that, was it a year or 2 years or whatever it was. And then they came back and said, we're only doing physical activity, healthy eating, which now, obviously we work in those policy areas, but when it went from 6 priority areas to 2, and we had just gone to every community and said, what do you want to work on? What's your priority? And they picked all these things. So the ones that didn't work, physical activity and healthy eating, then you had to go back and ask them, okay, well, we asked you what you wanted to work on, but now we're not doing those things. So now we're going to go back and we want you to figure out what you want to do in these 2, even though you didn't pick those 2 in the first place. So yeah, we unfortunately sometimes change our priorities, and that is the way it is. It is going to be always like that, probably for public health. But again, it's saying, I think it's admitting, you know what, this is out of our control, but I'm still here and I still want to hear what you have to say. I'm sorry, it's out of my control. We could always blame the ministry and nothing else. Be like, it's not me. Yeah. So, and it's just, you know, it's not the scapegoat. It's just, these are your communities, and I'm still here, and I still want to hear you. And that's, it comes back to the building relationship. Is, you know, I didn't have control of this. It's not how I planned this, but we still want to work with you. And now these are the new guidelines. It's what's worked for us.
And I would say, just to build on that, is that follow-up piece is really important, because what often happens is we invite people to come out to a workshop and we say, we want your opinion, and we get their opinion, and then we go and we do something else, and those people have gone away and they have absolutely no idea what we're doing. And then 2 years later we call them back for the same reason or a slightly different reason, and they say, hey, you didn't listen to me the first time. But so important when you're doing consultations of any kind, whether it's community or whether it's decision makers, is to close that loop. You know, whether it's sending a follow-up letter, a follow-up email, whether it's putting something in local media saying, thank you for coming out, thank you for your ideas, and being honest. Unfortunately, this time, we can't really follow what you're suggesting, but we heard you, and we're glad you told us, and we want to come back to you. There's still people that are going to be hurt and upset, and I certainly wouldn't blame them for that. But by being open and transparent and by closing the loop, that can really help. We hear this a lot, in particular with the Francophone community, which is a fairly small group of folks in Ontario who feel like they are consulted all of the time, but their opinions are not listened to. And then the next year, and the year after, and the year after, we go back and then we ask them the same question, and they tell us the same thing, and no one can understand why everyone's getting so upset. So it's that notion of follow-up that I think is really critically important. And at the beginning of the consultation also, being clear, we hope that we can follow your input. We're going to consider it to the best of our ability. Does that help? Okay, oh good, that's excellent. Okay, so the other thing I wanted to mention, which might be helpful for you, and this is a new-ish tool, at least new to me tool, and it's called Health Impact Assessment. And there's a few different versions of it. Some of you may be familiar with the Ministry of Health and Long-Term Care's Health Equity Impact Assessment, and really the tools are very similar. But the example that I wanted to talk about is in Perth County in Stratford, and this was part of the work that they're doing within their Healthy Communities Partnership. They are implementing, or hoping to implement, a policy for daycare centers around healthy eating and physical activity. And I was looking for a project to conduct my very first health impact assessment on, and they were looking for some community consultation work for their policy. So it turned out that we were able to do this together, and we're just partway, we're about to go into the actual community consultation portion of the health impact assessment. And health impact assessment, it's one tool, it's a tool, but what it's really about, it's very similar to environmental impact assessment. We all heard about all the different gas pipelines that are coming in, and there are assessments that are being done to figure out, so what are the potential impacts to the environment going to be if this pipeline goes through. Similar to that, health impact assessment is really looking at what are the potential impacts on health that this policy may have. Unintended positive, negative, what are some of those things going to be? And the great thing about HIA is that it's really a mechanism to go to your community and ask for their advice. And the HIA model, when it comes to community participation, is pretty simple, where it's really, these are the things that we're considering. How's this going to affect you? You know, first of all, what's going on now? So, which is a great question to ask, particularly around your topic area. What's going on now? What does it look like now for you, for your community, for your clients, for the people that you work in? And if we do this policy, or that policy, or that policy, how is it going to look? And give them an opportunity to say, oh, I like that one, but it would be awesome if you put that bit in there. And then instead of having policy option A, B, or C, you've invented a whole different D option for folks to really kind of resonate to. So having that type of workshop format can be really helpful.
So would you recommend that, because my workshop's going to be in 4 stages. One's going to be the lawyer talking about the risks and benefits. The second part will be like a larger group discussion around what's done already and what can improve in terms of services for people living with HIV. Then there's going to be a PHA panel, which is a person living with HIV panel, so people with experience will speak. The last portion, I was going to go over different types of policy and like as examples, and then I was going to have them sit in groups and maybe write their own. Would you recommend that maybe I go through that with them, or?
I don't know that you necessarily would want to do an HIA, but you might beg, borrow, and steal a little bit, and I'd be happy to chat with you on the phone about some particular options for you. That sounds like an awesome day. It sounds like a big day.
It's going to be a big day.
And one of the things that often happens with policy, and if I may say so, particularly from a public health perspective, is we love to tell people stuff. And what people really like to do is they like to tell us stuff. So, and this is just, I don't know a lot about your situation, so I may be making comments that aren't totally appropriate for you, but just as an example, maybe you don't need to tell them what's already happening. Maybe you can just ask them.
Well, that's the idea, right? It's having a larger group discussion and saying, what are you doing already? What's already happening in your organization to accommodate the needs of people living with HIV?
Yeah, that sounds perfect. Yeah,
Well, again, I want it to be led by them. I don't want to be leading it, right? Because if I lead it, the barriers go up. There's so much stigma and discrimination attached to HIV that I have to allow people to advance within their own comfort zone, right? And if I start pushing policy, if I start pushing people to
you start going top down.
Exactly, they're going to balk, and no one's going to show up for a workshop. You know, so that's the idea, is to have it come from them as opposed to it coming from me, right?
Yeah, that sounds perfect. Does anyone have any advice or any suggestions? Okay, great. Well, hopefully that was a little bit helpful, and there'll be some more stuff a little bit later on too. Okay, so part of what we're doing with this approach in Stratford that I think is really important is that right from the beginning, the decision makers, and in this case that's the folks who are actually running the daycare centers in Perth County, they've been involved. So there was a stakeholder work group that's been involved right from the beginning. The policy development process itself, it's based on evidence. So what are other folks doing? And tomorrow, if you come to the policy panel, you'll hear from Ellen Kiziak from Ottawa Public Health, and they're doing a very similar policy. And their approach was quite different, because in their case, the daycare centers came to the health unit and said, we want a policy, will you help us write one? Whereas in the case in Perth County, it was the health unit and the community partnership saying, we want to do this, how do we engage people? And we know that if we go out to the daycare centers in Perth County and we say, here's what you have to do, they're going to say, yeah, I don't think so. So one of the things that we're really going to be doing in our community consultation process is that, again, asking them, what's it like for you now? What's it going to be like for you after this policy is implemented? What are some of the things that you would need in order to actually put this policy in place? So that uptake piece, which is, do you need support? Do you need training? Do you need resources? Do we need to put something into the policy that says, we want to provide 2 PD days a year for daycare staff? And of course, with daycare policies at the municipal level, the really interesting thing is that municipalities don't have any jurisdiction. The legislation is at the provincial level, and the Day Nurseries Act is currently being revised. So really, this isn't a policy so much as it is, here's some best practices, here's some guidelines, that if you want to make sure that the kids in your daycare center have the best health possible, have the best possible start, these are some of the things that you can do in your daycare setting, and here are some of the things that we can do to support. So before the policy is even really totally written down, doing the community consultation and getting those voices included in the policy as much as you can, and closing the loop back with the community to let them know how you've incorporated their ideas. Okay, my next point is knowing where to start and who to involve. And you can really see that the first three barriers are really kind of all along a common theme. Once you have a sense of how much support, or lack thereof, you have for a policy, you can kind of figure out where you want to go to next. And I think we've talked a fair bit about developing partnership, about nurturing relationships, about going and talking to people, leveraging all of that to help you move forward. And one thing that's really critical, and this came up in our Twitter chat, is really take the time to identify who it is that you need to have around you. Your opponents, your proponents, and the people who influence both of those groups of people. And ask your partners the same question. Who are the people that I need to talk to? Who are the people who influence the people that we want to get on board here? And one thing that segues really nicely out of that, and this was another conversation that I think our very own Robin Calder brought up, is the difference between worker bees and decision makers. And I bet lots of you who have been doing community work are very familiar with this little conundrum. If I have a partnership, a group of people, and we're looking at addressing policy, who do I need to have around my table? Do I need to have the frontline folks, the folks who actually go out and do the work? Do I need to have the decision makers at my table, the people who can say, yes, I can write that down, yes, I can bring so-and-so to this table? It's a question that only you can answer, particular to your policy, particular to your community, particular to your partners. But one of the things to not forget is that often those worker bees are the folks that influence the decision makers. They're the ones who brief the decision makers. They're the ones who tell their decision maker, this is something that I want to work on for X, Y, Z reason. So it's never a cut and dried thing. Only decision makers, only worker bees. It might be a little bit of both. You might need to have different committees. There's all sorts of different ways that you can go about doing that. But really what I wanted to mention is make sure that you consider that. Who do I need around the table? And not only answer that question for yourself, ask your partners that question too. Okay, my last common barrier, and I mentioned this before, is that policies that affect the health of our communities are often implemented by sectors outside of health. And if I may, I'm going to plug the Health Impact Assessment and or its sister tool, the Health Equity Impact Assessment. The cool thing about Health Impact Assessment, in my biased opinion, is that it's really designed to be used to look at policies and programs that are outside of the health sector in the first place. So we typically don't do a health impact assessment on a health policy. We're making exception in the Stratford circumstance for a variety of reasons. But really we want to do something like that on an education policy, on a municipal policy or transportation policy, to really figure out, if we do this, how is that going to impact health, positively or negatively? What are some of those unintended consequences? But also key for this whole working outside of health thing, it comes back to partnerships and relationships again. And it comes back to working on those relationships, building those relationships, ideally before you need them. So that you're not building a relationship for the purpose of the policy, but you're leveraging your relationships for the benefit of the policy.
Can I just offer a suggestion on what that might look like?
Yes, please.
I've been in this position for about 4 years now, and up until this point, my job was to make friends with all my future partnerships. So I sat on every committee I could possibly find, any coalition, any planning committee. I'm a board member for 2 agencies in town. I really worked at building those partnerships by really doing my part in some of the work that the coalitions entail, and really proving myself. And that really honestly was the way that it happened for me. And so it's easy for me to call them up and say, hey, I need to do this, can you help me out? And they will, because they know I'm good for it, right? So that's what it looked like for me. That was the way that I was able to foster those.
I think that's a great point, and what you're reminding me of is that I've really been approaching this whole workshop from the point of you guys going out and doing your policy. The other way to be involved in policy work is you working on somebody else's policy. And I always say lots of heads nodding. I have a very severe case of volunteeritis. I am on lots of coalitions, work groups. I'm always volunteering to do work. And people often say, oh, why are you doing this to yourself? And I'm like, are you kidding? This is how I influence change.
Exactly.
For an example, when the ministry started the Healthy Communities Fund, I volunteered to co-chair the working group with the ministry that was writing the guidelines. I sat down with them and I wrote the guidelines, which were then taken out of my hands just in the interest of walking out of this room. But the point is that when you volunteer and you get involved, as you have done, you actually get to influence the change. It's not just sitting around the table and participating in a committee. It's actually, it gives you an opportunity. When you volunteer to be co-chair or chair or a member of the executive, you actually have a little bit of power there. Sometimes not a lot, but it's certainly more than if you weren't at the table at all. Mm-hmm. So I'd really encourage you to do that. It's a great way to build relationships.
And I mean, and another key point, and I mentioned it earlier, was that transparency. I never go into a project with any type of hidden agenda. You know what I mean? I'm very clear about what my goals are and what my role is and whatever I'm engaging in, so that people don't get any surprises, right? And I always say it in a sense like, I'm here because this is what I want to do. Who's in? Who wants to help, right? And then it creates some of that dialogue. But I always offer others to lead it. So I'll organize the coalition or the committee or whatever, but I always let the members lead it. I never take the lead. I let the people take the lead, and I just kind of follow.
That's great. That's a great talent. Okay, so right at the very end of my presentation, we've got lots of time for questions and discussion still. So during our Twitter chat, people were talking about all the various things that need to go into policy and partnership, and I started thinking about that children's book, Stone Soup. Does everyone familiar with that? I have nieces. Yeah. So just for a very quick recap, and I'm going to probably get some of the details wrong, but essentially, someone walked into a town and said, I can make stone soup. This person had no food, they had nothing. And people in the town are like, wow, how do you make soup out of stones? You put stones in a pot filled with water, and then you say, wow, this would taste so much better if someone had an onion. And someone says, oh, I have an onion. And they go and they bring it. Oh, this would taste so much better if someone had a carrot. And someone else says, well, I have a carrot. And they run and they grab a carrot. And sooner than later, they've got 20 people that have put ingredients into this pot, and you actually have a full soup. The reason I wanted to tell that story is that sometimes you don't have a lot to bring, sometimes you have something to bring. But all of your partners and all of the people who are working in the same area or a similar area or in your community, they all have something that they can contribute to the work that you're doing. And it's really, really important to acknowledge that nobody can do this work alone. Granted, there's that example in Haldeman and Norfolk where 4 people made provincial legislation, but outside of that,
They were alone. There's 4 of them.
yeah, exactly. There were 4 of them. Okay, and some of those key ingredients in this stone soup. We talked about partners lots. We talked about relationships lots. We talked about creating a common understanding. We talked about clearly articulating your issues and your goals. Patience, patience, patience and a little bit more, and good planning. Going back to that roadmap, following the steps. So just in wrapping up, sometimes working on policy can seem insurmountable and we can feel pretty small in the face of it, but a way can always be found. And some of the resources that I would highly recommend, I mentioned the THCU resources, and they are still available. If you go to thcu.ca, it redirects to the Public Health Ontario website, but all of those great resources, there's a searchable database that you can use there. These are resources, and also these are the materials that I used in putting this presentation together.
The OCDPA has a wonderful toolkit, and PARC also has a really great workbook that pick up on that roadmap and break everything down step by step. And there are worksheets and there are examples. They're very, very helpful. And of course, the resources on hclakeontario.ca. So if you just go to the resources tab and you'll see the policy section, and there are lots and lots of great resources, both HC Link resources, and we've linked to other folks like the THCU and the OCDPA and the PARC toolkit are all linked from our website too. I also wanted to mention something that we have at HC Link. It's a learning community, which is just kind of our term for a community of practice. And the learning community is a group of folks working on Ontario in a variety of sectors that are all working together on policy. And we have an online space. We have workshops and training events through HC Link that are specific to policy work. And I would highly encourage you to sign up for the community, and you can do that on our website as well. And it's a great group of folks to ask questions to ask advice, because people have been doing this work for a long time and they know lots of really great stuff. And I also wanted to mention that not only do we have resources on our website, we also have resources walking around in bodies like mine and Robin's and lots of other the folks that you've seen wandering around this conference. And we are a resource center with tools and supports available to you. And we are publicly funded thanks to the Ministry of Health and Long-Term Care, which means that many of our services, especially when we go out to your community, are publicly funded, so there is no cost or little cost to you. We can work with you over the phone. We can actually come up to your community. We can help you facilitate a workshop. We can help you get partners together. We can provide you that just a little bit of external assistance, a little bit of an external facilitator, a little bit of an external view. And we, I think I can say we love doing that. I love doing that. I spend an awful lot of my time sitting in my office writing reports. I love getting out to the community, so please call me and I will happily come to you and actually talk to people and not just scream. So that is the official end of my presentation, and we do still have some time, which is awesome. So does anyone have any final questions or comments? Hi. You can just remind us your name too, please.
It's Kendra again.
Thanks, Kendra.
Again. Just your slide, the baseball field. There's been a lot of discussion about that picture in my health department, and I wonder about whether it would be appropriate to show that particular slide outside of a context like this as it's presented side by side, because it looks like the initial state is everyone has those boxes, and then somebody has to give up their box to give it to someone else. And I would phrase it as like two separate slides if I was going out to the community, because you can do that option so some people can see, or you can do it so everyone can see. Yeah. I think the idea of giving up the people of power and privilege to someone else is not an easy sell all the time, or get rid of guns, like is the other option. Like, I think it's great for this scenario. Because we're going out to people who don't have a similar framework of thinking. It might be a challenge. It's just a caution.
Yeah, I think that's a really great point, and it's funny because this is the first time I've used this picture in this presentation. And as I was actually speaking half an hour ago to this slide, I said, ooh, that kind of looks like somebody's giving something up to give to somebody else further down the line. And I mean, we know in Canada where our social safety net is very much set up in that way, where we pay, the people who have money pay taxes, and that benefits everyone, but mostly the folks who don't have as much. But I mean, I think we can just look at the dialogue going on in the United States to see that it's not an easy sell all of the time. So I think that's a really great point. I'm curious if anyone else has any stories or pictures that they use to illustrate health equity that maybe don't have quite that same tinge.
I think the other slide you had about the race finish line is a nice one. So it's not about the person at the top now having to add added barriers or something, but it's using
The thing I love about this slide is that I use my mom often for a guinea pig. Hi, Mom. Because my mom doesn't work in health. My mom's a retired teacher. And like lots of, I bet, our families, she struggles to figure out what it is we actually do. And I can show her this picture and she totally gets it. Like she understands it, it makes sense. And the other resource I think that's really helpful is the video originally developed by the Sudbury District Health Unit, probably lots of you have seen. Let's talk about health without talking about healthcare. And I know lots of folks, not only in Canada, but in the States and internationally, have adapted that video. So I think they're great tools. There's also a really wonderful blog post that we used in an internal training not too long ago about shoes. That I think is a really great illustration of equity. And what I'm going to do is look that up and include it in the resource section when this is posted online. So, no. And I'll also tweet it out a little bit later once I find it.
Another resource that I use to illustrate, we use both these pictures as well, but not that it's new information for, I feel like for us, but to express to the community, upstream.com. So it's just been released. It actually started out west by Dr. Ryan Miley and his group. And really, they just needed a way to explain really what we do. Kind of that upstream thinking, you know, we're going to build a fence at the top of the river instead of everybody falling in and grabbing them out of the bottom as they drown in quad. So, but they've made a good video to show that if the resources go into building that fence at the top of the cliff, instead of putting the resources into another ambulance at the bottom, that it's the same resources except that the people don't have to go through the falling through the river part. And there's lots of resources in there and they have some good imagery of being able to go to the community to talk about that prevention, equality, equity lens. So hasn't been out very long, but it's called Upstream. Just search Upstream, and yeah, it's good.
We'll make sure that gets tweeted. If I know Robin, she's probably already done that. So we'll make sure that that's available for folks too. It's a great suggestion. Really quick, I'm actually going to think a few more times about that picture before the next time I do this workshop. Thanks.
I still think it's a great picture. It's just the
Yeah.
order in which it's presented left to right way we hit it.
It's great. Any other questions, comments, thoughts, stories, creative, interpretive dances?
Maybe as we're just thinking of our next comments, I'll just say, because people have to leave a little bit early, we are doing the evaluation at the back, just like your last session. So the stickers, I believe, are just below the paper. So grab a sticker, plot it on the chart, the right top being the highest and the bottom left being the lowest. If you could do that, take 2 seconds, just so we get some feedback to make improvements for next time.
And I'm just going to say too, while you're thinking of your next question or story, that I would love to hear feedback from those of you. Even just come on up to me and let me know, or mention them maybe to Robin or to Mel. Especially for those of you who have done a lot of policy work, because I know there are a lot of you in this room. I would love to have your feedback on, you know, was this really introductory? Was this really basic? Did you actually still learn some stuff from it? Because that will just help me as I continue to go out and deliver this workshop and refine the description and all of that kind of stuff. And I just love to talk to you and hear what you have. So, any final questions or comments? Fabulous.
All right, well, I want to thank you, Andrea.
Thank you.
Great, as always. Like Andrea said, she's not scary, I promise. So definitely come up and talk to her and ask questions. I know sometimes it's asked when you start thinking about things. Obviously, both of us are here all day tomorrow as well. If something comes up in your mind overnight, you're thinking about what was discussed, by all means, grab us tomorrow.
And there is a meeting in this room in 11 minutes, so we might have to move out into the hallway, but please feel free to do that. We'd love to talk to you. Thanks, everybody. Enjoy the rest of your conference.